Dogs don't speak our language, but they do communicate. Often, our furry friends show us how they're feeling through subtle, and sometimes not so subtle, behaviors. Recognizing the signs can be the key to understanding their needs and keeping them healthy and happy. 1. Unusual barking or whining. Is your dog suddenly vocalizing more than usual? It could be due to anxiety, pain, or even boredom. Persistent whining might mean discomfort, while excessive barking may point to something in their environment bothering them. 2. Excessive licking or chewing. If your dog is constantly licking their paws or chewing at certain areas, it could signal allergies, skin irritation, or even joint pain. It's not always just a grooming habit. It could be a call for help. 3. Hiding or isolation. Dogs that suddenly withdraw from family members or hide in corners might be feeling sick, stressed, or fearful. Sudden changes in social behavior should never be ignored. 4. Tail position and movement. A wagging tail doesn't always mean happiness. A low-hanging tail, tucked between the legs, or stiff wagging could indicate fear, anxiety, or tension. Pay attention to context and the rest of your dog's body language. 5. Changes in eating or drinking. A drop in appetite or increased thirst might seem minor, but they could signal anything from dental issues to digestive problems or even more serious conditions like kidney disease. 6. Panting and pacing. Dogs pant after play or in warm weather, but if your dog is panting excessively indoors or pacing frequently, it might be a sign of stress, pain, or overheating. 7. Yawning, shaking, or lip licking. These might look like ordinary habits, but they can actually be stress signals. Dogs often show these signs when they're nervous or uncertain about their surroundings. 8. Sudden aggression or fear. If your normally gentle pup starts growling, snapping, or acting fearful, it might not be a behavioral problem. It could be a symptom of pain or discomfort. Aggression is often a dog's way of protecting itself when something doesn't feel right. 9. Changes in sleep patterns. Is your dog sleeping more than usual or struggling to rest? Oversleeping may signal lethargy or illness, while restlessness at night can point to anxiety, discomfort, or even cognitive issues in older dogs. 10. Scooting or dragging their bottom. Though it may look silly, scooting can indicate discomfort due to impacted anal glands, worms, or irritation. If your dog is doing this frequently, it's time for a vet visit. 11. Staring or avoiding eye contact. Intense staring might mean your dog is trying to understand you, or it could be a dominance behavior. Avoiding eye contact, on the other hand, could be a sign of fear or submission. 12. Shivering or trembling. Dogs shake when they're cold, but also when they're scared, anxious, or in pain. If there's no obvious reason for the trembling, it's best to get them checked out. 13. Destructive behavior. Chewing furniture, digging, or tearing things apart isn't just mischief. It could be a sign of boredom, lack of exercise, or separation anxiety. 14. Gasping or gagging. If your dog is gagging frequently or having difficulty breathing, it could indicate respiratory issues, a choking hazard, or a potential allergic reaction. A visit to the vet is recommended to rule out serious health problems. 15. Constant scratching or biting. Excessive scratching and biting could signal skin allergies, parasites like fleas or ticks, or dry skin. If this behavior persists, it's important to check for external irritants or underlying health issues. 16. Excessive drooling. While some drool is normal, excessive salivation can be a sign of nausea, dental problems, or even poisoning. If drooling is accompanied by other unusual symptoms, consult a veterinarian immediately. 17. For loss or bald spots. Hair loss or noticeable bald patches can point to conditions like allergies, hormonal imbalances, or parasites. Keep an eye on your dog's coat and bring them to the vet if you notice patches of missing fur. 18. Disinterest in favorite activities. If your dog suddenly loses interest in walks, playtime, or food, it could be a sign of depression, discomfort, or illness. Dogs that are typically active and engaged but become lethargic should be examined by a vet. 19. Excessive drinking or urination. An increase in thirst or urination may indicate diabetes, kidney problems, or urinary tract infections. This behavior should not be ignored and should be addressed by a healthcare professional. 20. Pacing or restlessness. Dogs may pace when they're anxious, in pain, or stressed. This restlessness can also be a sign of cognitive dysfunction in senior dogs. If it continues, it's essential to get your dog checked for potential issues. 21. Avoiding certain areas or people. If your dog suddenly avoids a specific room or person, it could be a sign of past trauma or discomfort. This behavior might also suggest that your dog is feeling threatened or scared by something in that environment. 22. Sneezing or snorting. Occasional sneezing is normal, but frequent sneezing or snorting can indicate allergies, nasal infections, or even a foreign object lodged in the nose. If this persists, a vet visit is advised. 23. Head tilting. Head tilting can be a sign of ear infections, hearing loss, or even neurological issues. While it's often cute, if it's accompanied by shaking, scratching, or balance issues, it's important to get it checked out. 24. Hunching or arched back. If your dog is hunching or showing an arched back, it could be a sign of back or abdominal pain, or even more serious conditions like kidney disease or gastrointestinal distress. Any abnormal posture should be addressed. 25. Increased vocalization, not just barking. Dogs may howl, whine, or make other vocalizations to indicate frustration, distress, or a need for attention. If the vocalizations become frequent or loud, consider the emotional state of your dog. There might be something deeper bothering them. 26. Tightened or stiff muscles. If your dog shows signs of stiffness, difficulty moving, or reluctance to jump, climb stairs, or walk, they may be dealing with joint pain, arthritis, or a muscular issue. Regular vet visits and sometimes medication can help. 27. Unusual gait or limping. If your dog suddenly starts limping or their gait seems off, it's a clear indicator they might be injured or dealing with a condition affecting their movement. Even if it seems minor, it's always better to get a professional opinion. 28. Rolling in feces or dirt. While it may seem unpleasant, dogs sometimes roll in strong-smelling substances as a way of masking their scent, or simply because they enjoy the sensory experience. However, it could also be a sign of underlying anxiety or a need to express dominance. 29. Sniffing excessively. Dogs are naturally inclined to sniff, but excessive sniffing could be a sign of stress, confusion, or a medical condition. Keep an eye on when and where your dog is sniffing, and consult a vet if it's accompanied by other strange behaviors. 30. Loss of interest in socializing. Dogs are typically social animals, so if your dog becomes reclusive or avoids contact with people or other pets, it may be suffering from a health issue, anxiety, or depression. It's important to understand the root cause of this behavior. What you can do. Being in tune with your dog's behavior can make a huge difference. Here's how to respond. Pawprints keep a behavior journal, track unusual actions or changes. Dog face visit the vet regularly. Rule out or treat medical issues early. Speech balloon work with a trainer or behaviorist, especially for signs of fear, aggression, or anxiety. Brain keep your dog mentally stimulated. Use toys, games, and training exercises. Orange heart show patience and love. Dogs thrive on positive interaction and routine. If you found this video helpful or eye-opening, please give it a like, drop a comment with your thoughts, and don't forget to subscribe for more content like this. Your support helps spread awareness, and it means the world.